My name is Silvia Sacalis, and I'm the Vice President of Clinical Services at Healthesystems. What inspired me primarily to become a managed care pharmacist was I wanted to make a difference from behind the scenes. I wanted to be an advocate for people. I wanted to be a change agent and a decision maker. And managed care pharmacy really has allowed me to do that. A little bit further from a backstory perspective, I was really fortunate when I was a pre-pharmacy student to have a mentor who exposed me to managed care pharmacy and showed me that there was a different perspective and a different way to be able to influence change. That being coupling your pharmacy training, your scientific curriculum with business decision making and your business acumen. And that's really what inspired me to become a managed care pharmacist. If I wasn't a pharmacist, I actually would be a sports newscaster. I have an equal passion for making a difference with people in different arenas. I absolutely love sports, primarily baseball and football, and I feel as if the sports arena doesn't really offer women as much of an opportunity to make a difference, and that would have been my passion, to be able to couple my interest in sport and really be able to make a difference as a woman in that environment. I think that that particular environment really could benefit from some smart, passionate women. I found that workers' compensation is a unique niche to really continue to be able to make a difference in a different way. There's a lot of unmet needs in this patient population. Felt like it really matched my personality and my passion for being a change agent. And so I think I'm uniquely positioned to work very collaboratively with my team to come up with innovative strategies, maybe from a higher perspective, to really be able to influence downstream execution of certain programs that could change the lives of others. Workers' comp has evolved significantly. There's been a lot of reform in terms of deploying patient safety programs, formulary changes all across the state population to really focus on how to better improve treatment, appropriate treatment for patients, as well as how to better deploy a broader collaboration among key stakeholders. There's still a lot of work that needs to be done around workers' compensation care and the balance with economics. We have made significant strides in the past few years. I would say from a clinical perspective, sometimes doing the right thing for the patient can be front-loaded with costs, but it does significantly decrease spiraling medical costs downstream. I think that's an area that workers' compensation needs to continue to evolve into, really pursue. I would say there's a lot of positive focus on injured worker outcomes overall. I do see stakeholders coming together, trying to do the right thing for injured workers. Our philosophy and our values, Healthesystems is really focused on workers' compensation as the core of our business. We are very customer-centric. We understand the specific needs and the ability to be flexible in meeting those customers' needs, utilizing technology as well as different analytical tools and our clinical expertise. I think we are uniquely positioned to make a positive difference in workers' compensation. Healthesystems is really focused on improving patient healthcare as well as the patient experience overall through education, advocacy, our clinical intervention tools, and our varied interventions to external stakeholders. As a pharmacy leader at Healthesystems, I impact the outcomes of injured workers by being vigilant to evolutionary workers' compensation trends and bringing back that information internally to optimize and create innovative clinical strategies. Being an employee of a company like Healthesystems that really supports their employees and is really passionate about doing the right thing for their customers makes me really proud not only to be in workers' compensation, but to be an employee of Healthesystems. Healthcare delivery will continue to evolve and change in both the broader healthcare environment as well as workers' compensation, primarily being driven by technology. Technology will continue to streamline communication. Telehealth will also have a significant role in workers' compensation, really focused on improving the delivery of the actual intervention and the appropriate modality for that particular injured worker. How will it affect our pharmacists specifically, both the ones that are on the front lines as well as from a leadership perspective, is the ability to innovate and continue to evolve with the changing dynamics of the marketplace, ensuring that the tools and the strategies that we deploy will meet those evolving trends and dynamics in the marketplace. The issues that are most important to me as a clinical leader within our organization is to ensure I'm supporting my team effectively. The issues that are most important to our customers as well as prospective partners are focusing on improving overall outcomes for injured workers, improving return to work, and ensuring that there's a balance between the overall outcomes and the economics. I would like to see more innovation in terms of processes, in terms of technology, and cross-collaboration across all key stakeholders. My favorite quote that guides and inspires my work is by Phil Jackson. "The strength of the team is each individual member, and the strength of each member is the team."